Good morning, everyone. This is Dr. Merkle with Take Two Healthcare every Saturday, 11 to noon. And we're here. The name of the show is Take Two Healthcare. Our motto is take 2 weeks or 2 months to try safe and natural option, because even serious problems sometimes have simple, safe solutions. And I've been here behind this marvelous microphone for over 30 years, right here in the Miami Valley for over 40 years. And you've heard us talk about many patients with many extreme, serious, end-stage conditions. People with kidney failure, liver failure, stage 4 cancers truly go into remission. Now, it's not because I have a magic cure for everything or anything. We don't. But what we do a lot of testing. Lab testing, heavy metal, toxic chemical testings. We live in the most toxic environment the world has ever seen. And I think that correlates with how sick we are as a population. And we are, I think, 48th or 49th in longevity in the world. There are 48 countries that have longer lifespan than we do, and yet who spends more money? By far, per population, nobody spends more than the United States does. And yet we have, as there's a study said, unusually poor outcomes compared to other industrialized nations. Yeah, our medical outcomes are below, well, actually you could use lifespan as one of them. If we're 48th or 49th, there's a lot of things we're not doing right that other countries are. And that's why I'm here. I'm Dr. Merkle. I'm board certified in clinical nutrition. And that's what we do. We try to find out why you are sick, not just, that you are sick. That's not hard to do. But find out why. And that's what we do with our testing. Most conditions will show in the blood long before you have symptoms. And if you get healthy enough, does it really matter the name of the disease? Whether you got psoriasis, you have Crohn's, got high cholesterol, high blood pressure, whether you've got cancer, lupus, MS, rheumatoid arthritis, doesn't matter if you get healthy enough. Now, here's a question that I talk to doctors about. The most important question you need to ask a patient that's going to give you a lot of information is, how long have you had the problem? How long have you had the problem? Reminds me of a case. A lady came in, this was several years ago, and her uncle and cousin died from lupus. She's got lupus. She's 30 years of age. 30 years of age. And when she came to see me, it's a desperate situation. She's been to Cleveland Clinic, the Columbus Clinic, the Mayo Clinic. She's in a wheelchair and going downhill fast. They're doing kidney biopsies and things like that, waiting for something to fail because of all the meds she's on to try and reduce her immune system, reduce the inflammation, and all the things they were doing, reduce the pain, etc., was where the disease was killing her and or the side effects of the drugs. Anyway, she was going downhill fast. And in the wheelchair, I'd seen another lady about that bad when I was at Logan College, chiropractic college. And she went to a church I went to, and that lady at the church died before I graduated 3 years later. And here's this lady coming in at 30 years of age, worse than that, going downhill fast. Okay, she's got a cousin and a uncle that died from lupus. Is this genetic? Okay, there might be a genetic tendency. Notice why I said a genetic tendency is not a physical certainty. So I'm talking with her there, her and her husband are there, and they've got 3 young children, and it's a pretty dire situation. And this was many years ago when I first started doing this. And in fact, a lot of my philosophy actually stems from, or parts of it stems from, this one case. And I was talking to her there, and very bad with lupus. She's 30 years of age. And I asked her, did you have any sign of lupus in high school? No. I mean, no sign of lupus at all in high school? No, she played some high school sports. Wow. I said, how about college? Do you have any sign of lupus in college? No. Well, when did you start getting symptoms? At 24. Age 24, You live 24 years of your life without any signs of lupus. So the next question asks, why do you have it now? If you live the first 24 years of your life without lupus, why do you have it now? Oh, you can say, oh, it's genetic. Well, she had the same genes when she was 20 as she does at 30. Why does she have it now? Something is different. Something is more deficient, imbalanced, more toxins, chemical heavy metal. It's probably not just one thing. It's probably a combination of things. Now, the easiest thing to do is what the medical system is doing. Let's just pound down the symptoms. Let's give her painkillers, immune suppressive drugs, anti-inflammatory drugs, painkillers, all this stuff to reduce the symptom. And I come along and say, well, and I actually remember telling this, if we could get you as healthy as you were at age 24 when you didn't have any symptoms, if I could get you as healthy as you were 6 years ago before it started, how would that be? And I remember the look on her husband's face. It's like the clouds came out, the clouds parted, the sun came out. What a concept. And so that was my goal. It wasn't to cure her lupus. It was to get her as healthy as she was before the lupus started. What a concept. You're not going to get this in the medical field. Medical is designed to treat symptoms, not find the true cause of the problem. And so I tested her. Now I know a lot more now than I did then, but I tested her. I did what I knew. I did what I could do. And then we tested her again, and she came back in 2 months where we retested some of the things again. And guess what? She felt no better. 2 months, she didn't feel any better. But we saw the labs, and the labs told me that she was better. And I was able to tell her, I know you don't feel any better, but your body is healthier. Now, I have to explain this to doctors and patients sometimes. Essential or non-essential? Is it what's more important, for your body to get healthier or for you to have energy and feel good? Do you think your body's going to prioritize maybe fixing your kidneys, your liver, working on some internal things first before it gives you energy and makes you feel good? And so that's what we did. We tested her, and I told her, look, I know you don't feel any better, but remember what I told you that first time? If you improve 2 or 3% every 2 or 3 months for the next 5, 6, or 7 years, where will you be? And I said, you're right on track. At 2 months, I know you don't feel any better, but your body's healthier. We are on the right track, and it's just a matter of time until you start feeling better. But that's not the most important thing your body's working on right now. It's got some more important stuff to do than make you feel better. And we see signs of that in the labs. Your body is healthier. And because I was able to show her that with our lab testing, that we just don't throw stuff at people and hope it works. No, we're doing it with purpose. We know what we're doing and why. And then we expect to see results in at least a couple months. Generally 2 weeks. For some people, it's 2 weeks. If you got end-stage cancer or maybe kidney failure, liver, or whatever, sometimes we'll retest something in 2 weeks, just to make sure we're seeing progress. But for her, we waited 2 months, and we saw a little progress. I said, you're on the right track. You're on the right track. 2 or 3% improvement every 2 or 3 months, where we'd be in 5 or 6 years. And within about 6 months, she was back to normal with no signs of lupus and she was off all of her drugs. It was a phenomenal story, and some of you might remember she's been on the radio show and several times. But that is where this thing started. And that's one of the things, last weekend, where was I? I was in Minnesota. I was lecturing to a national conference. I was the keynote speaker on longevity. About 300 doctors there. And I am 69, and I try to practice and promote what I teach. I teach longevity. And at 69, I try to do things. Do I think I'm going to live to be 130, 150? Some people are. I'm just saying I want to live as healthy as possible, as long as possible. So I'm going to do things now to optimize my health so that I can work out, I can go travel, I can hike, I can do things. And maybe as important or more important, I'm not a burden to my family. I'm not a burden to my family. And I've said many times before, the most important thing you can do for your family, your friends, your children, your parents is not be dependent on them, financially or physically. Get out there and take care of yourself. If you got problems, if you're overweight, get it under control. Nobody wants to take care of you. They will. And I'm sure you have family members that will, but would they rather not? Yeah, would they rather you lose some weight, you get healthier, you stop eating crap, you start doing things? Would they rather not take care of you so they can live their life? Or are you going to burden them with your poor habits and poor choices? Okay, I know it's probably not what you want to hear, but is it true? Yeah, it's true. So that's what we did. We, on this lady with extreme lupus, 2 cousins died. She went into complete remission. And that's what we do. That is what we do. For whatever condition you've got, the condition of the body is more important than the name of the disease. Because sometimes the symptoms don't always correlate with the cause, or there's no obvious correlation. And that's why we test. We want to see what is going on. And we don't guess. We want to know exactly where you're at physically, how your body's dealing with your environment, and what is in your environment that may be detrimental to you. And that's why we test so very much. And we do test a lot because we don't want to miss something. Now the testing. And even the most extreme cases of testing, with all the labs we do and things like that, it might run, I'm going to be on the extreme high end. Let's say $4,000, $5,000. You can't go in the hospital for a day for far less than that. But once we get our information, we're going to know the score. We're going to know where you're at. It's also going to provide a blueprint of what your body needs, the way it's functioning. And if we follow that blueprint, that roadmap, we'll be able to and I'm going to say improve virtually any condition you have. You can get healthier. Whatever condition you have, there are things that you can do to be healthier if you choose. If you're willing to get tested, if you want to change your lifestyle, change some things, then there is a possibility that you could be one of the people we talk about on here. People who's had extreme conditions going through remission. Yeah. But again, we don't have a cure. And that is a difference in the medical profession. They're designed, they're trained, and their treatment is based on symptom reduction. Ours is get your body healthy. And that's what we do here at Take Two Healthcare. Our number is 937-433-3241. It's 937-433-3241. Take Two Healthcare is our website. We'd love to hear from you. And if you got some problems, we'd love to help you with that. Now, when we come back, we're going to be talking about hormesis. It's one of the things in longevity I talk about. We're going to take a break right now. When we come back, you're going to learn something new. And we are back. I'm Dr. Merkle with Take Two Healthcare every Saturday, 11 to noon. It's great to be with you on this Easter weekend. It's a beautiful day out there. Hopefully you'll get out and enjoy it and be with family and friends. It's a wonderful time. And I am going to talk about hormesis, but there's a caller that left a message. And it's Ann, and she was talking about blood work instead of a colonoscopy. And there are blood tests that could indicate colon cancer. But one of the first things, one of the most important things is there any blood in the stool? And that's what we've been doing for years. If there's blood in the stool, you got to determine what color is the blood. If it's bright red, it may be hemorrhoids or something in the lower part. If the blood is darker, it's a little higher up, and that's more problematic. But there shouldn't be any blood in the stool. And so there are, at our clinic we've used for 40 years, it's like a tissue paper. You have a bowel movement, drop it in. If there's iron in there from blood, it will turn colors, and then there's a problem. You have to determine why, and if it's positive, we will generally retest again just to make sure it's a good sample. Maybe retest it, a couple more times, And if it goes away, then we'll still check to make sure it stays away. This reminds me of a couple cases. There's a fella came in, and we saw blood in his stool. And I said, this looks like he should have a colonoscopy and see if there's any colon cancer. Sometimes you don't, if there's a change in stool, the size or something like that, it could be a tumor mass in the colon. And so the wife was pretty insistent her husband get tested. They did a colonoscopy, and they came back and said, no, they didn't find anything. I go, okay. But we tested it again because the blood didn't go away. And I said, I think they missed it. I think there is colon cancer there. I think they missed it. Go have another one. And so they went and had another one. They came back and said, they didn't see anything. So, okay, so we tested it again, and the blood didn't go away. And I said, I think they missed it. I think he's got colon cancer. And if you catch the early stage, maybe cutting the cancer out will work, but I think they missed it. On the third one, they finally found it. And the doctor said, well, it's only the size of your fingernail. How would you expect me to catch it? And so sometimes they found out in these colonoscopies, if a doctor is right-handed, they'll see certain things. If a doctor is left-handed, they'll see certain things. But they're not as accurate as what you'd think. Now, I also have another case that really comes to mind. Is where I work at Royal Swiss Village, my clinic. There's a business there, and the owner of that business, I are friends. And when he was 60, he had a colonoscopy. So, okay, I'm 60, it's time to get one done. So he did one. And that night after the colonoscopy, he told his wife, I just don't feel right. Got a really bad pain in my abdomen and just don't feel right, lower abdomen. And he said, take him back to the emergency room. They found that his colon had been ruptured. And they said if he had stayed, just tried to tough it out, take some painkillers, he may not have woken up the next day. It was that bad. And the guy said, the doctor that did the colonoscopy, they just happened to see him in the hallway. And he said and this was my friend's report of what the doctor said. The doctor just kind of smirked and said, well, S happens. S ends in T. He said, S happens, and walked right on. He said, if I could have gotten out of that bed, I'd have punched him. He said there was no concern, and, okay, it happens. Doctor's going to do it. And I had a lady come to see me for lab work, and her husband was a medical doctor. She was in her 70s. And I asked her if she had had a colonoscopy. She said no. I said, really? Why not? She said her husband won't let her get one. She said there are more problems with those colonoscopies than they're letting on. And, okay, my mom died at 92. She never had a colonoscopy. I'm 69. I've never had one. Now, there's some things that would lead you toward thinking you need a colonoscopy. Let me just hit them real quick before we take the break. Do you smoke? Do you drink a lot? Are you overweight? Do you have regular daily bowel movements, at least one or two? Do you have a lot of gas, flatulence? If you have a regular bowel movement, you don't smoke, you drink very little, your odds of getting cancer are extremely low. And I have at least 2 bowel movements every day. I never smoked. I rarely drink, like maybe, I don't know, one a month or something like that, a hard apple cider for digestion. And I'm trim. I'm not skinny, but I'm trim. And I eat really good. So the odds of me having a problem are extremely low. And I do check myself to see if there is blood. There's also a cancer markers you can do to see if if there's a tendency toward cancers, and one of them could be colon cancer. So those are things you can do. Evaluate if you need to do it, and is the risk of colon rupture worth getting, or a false sense of security that they didn't see it. So I'm just going to be checking for blood in the stool, and that's what I'd recommend you do. Very inexpensive to do. And evaluate yourself. Are you having normal bowel movements? Are you having blood in the stool? Those are all bad signs. No, not having normal bowel movement is good, but blood in the stool, there's a problem. Hemorrhoids, maybe something like that. But if you need help with it, contact our office. We can give you some guidance on how to take care of yourself naturally. Again, as I'm 69, and I'm telling you what I do. Now, I'm not telling what you should do because I don't know what you have done. If you smoked, if you drink a lot, if you're in poor health, if you're having a lot of gas and bloating, that's a problem. I don't have those, so I'm not worried about it. See, I know it's time for a break. You're listening to Dr. Merkle. When we come back, we're going to talk about hormesis. We'll be right back after this. And we're back. I'm Dr. Merkle with Take Two Healthcare every Saturday, 11 to noon. It's great to be with you, and our purpose, our mission, our goal is to help you be healthier, provide information, ideas that truly can change your life. And I like to share those things that I do. I study. And as I mentioned earlier, I was a keynote speaker last weekend at a conference. About 300 doctors were there, about 350. And as a keynote speaker, speaking on longevity, it's quite an honor to be there. And the doctors really responded well, and we're excited about the material I mentioned. And here's something that I presented at this that was new to a lot of the doctors, and it might be new to a lot of you as well. And that is hormesis. 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 And basically, we've all heard this: what doesn't kill you makes you stronger. Well, let's qualify that a little bit. Hormesis is a biphasic dose-response phenomenon characterized by a low-dose stimulation or benefit and a high-dose inhibition or harm. Where a toxin activity is beneficial in low or very low doses, they are toxic, even lethal at higher doses. Homeopathy would be an example of that. Possibly vaccines would be an example of that, typical vaccines. When you get a little bit of a toxin, your body responds and build a response to that. And so a little bit can be good, a lot can be harmful. And there's a lot of things like this. But let's just go into where this came about. Hormesis and arsenic. Now, there are some worms that's used for research all over the world. And it is a C. elegans, a type of worm. And they found that high amounts of arsenic is a, quote, surefire killer. However, the worms are instead exposed to a fixed, very low dose. They actually live longer than usual and become more resistant to other things like heat stress and other poisonous substances. Hormesis and paraquat. That's an herbicide. You use the same type of worms. A little bit using a low-dose paraquat actually increased the lifespan of worms, of these worms. That's mind-boggling. However, this is even more mind-blowing here. However, if these worms were given antioxidant nutrients to neutralize the damage from paraquat, then the damage was neutralized and the worms lived no longer than usual. Taking antioxidant vitamins was detrimental or neutralized the effects of hormesis. A little bit of paraquat boosted their immune system. They live longer. It gave them antioxidants. Well, shoot, we all want to take antioxidants, don't we? We want to take vitamin C and E and D and beta carotene, all this other stuff. We take antioxidants because we live in such a toxic environment. Let's look at another case. Hormesis and radioactive area in Taiwan in the 80s. And what happened there is construction steel was contaminated with radioactive cobalt-60. And 10,000 people were in these contaminated apartments exposed to radioactivity far above regular background normal levels. However, doctors found the apartment residents had fewer cases of virtually all types of cancer than comparable Taiwanese people. Hormesis and toxins in American history. American shipyard workers working with nuclear submarines have a lower mortality rate than workers at normal shipyards. U.S. population living in areas with slightly higher than usual background radiation live longer than average. Radiologists exposed to radiation, some live longer than other doctors and have a lower risk of cancer. A little bit can boost your immune system. But then too much radiation will give you cancer and die. So, what about today's culture? Is it possible the reason behind some studies years ago indicating a connection between alcohol or wine and longevity is because they only drank a little bit? You know, maybe a glass every 2 or 3 days. Well, now if you're drinking a bottle a day, you're going to lose that benefit. And so, are there benefits to some low levels of bad food? And I think, okay, maybe is there a benefit to a French fry once in a while? Or a chocolate? It boosts your body's immune system a little bit to respond. Okay, I'm using dark chocolate as my hormesis effect, okay? If I want to stimulate my immune system with something that may be detrimental, I'm going to use dark chocolate. Okay, that's what I tell the doctors. Dark chocolate is my toxin of choice. That'll boost my immune system. My problem is eating too much, so I try to keep it down. But is there some benefit maybe to coffee or caffeine or soda? Is pizza healthy in small doses? Well, most people can't eat just one slice. Remember the commercial? Nobody can eat just one. And here we are with vaccines, hormesis and vaccines. Is it possible that 50 years ago when I was a kid that a very few vaccines were a benefit? Now, it's the thought that if a little is good, a lot is better. And so when I was a kid, we had, well, I don't know, 4 or 5 vaccines or something like that. Now it's like 40. And so maybe a few boosted our immune system, but now we're taking so many that is there a negative toxic effect? And we've seen studies, and I think I got it here in my briefcase. The more if you've had any vaccines, especially lately, and follow the protocol, you are more likely to have all kinds of cancer, autoimmune disease, early death, all those kind of things. Now, hormesis in animals, long-lived birds don't have less oxidative stress than short-lived birds, and there is a type of rat, mole rat, have at least as much stress as shorter-lived cousins. There are certain types of naked mole rats. They live a long time, not because they're stress-free, but because they're equipped to deal with stressors. Maybe the secret to long life is not to live without difficult times, but to be able to withstand the onslaught and stressors. It seems like we have such weak-minded, weak-willed people that the least amount of mental stress freaks them out and they can't deal with it. You know, I think if you're one of those, you got to thank God every day that you live in the United States where you have very little true stress to worry about. You're not in a war area. You're not in a famine area. You're not in a drought area. Your biggest stress is a lot of times self-imposed things that you think are a problem because you have made them a problem, and that's all you focus on. So there are, here's some other things. Hormesis in humans at high altitude. People who live at high altitude tend to live longer and experience fewer age-related disease than those who live at sea level. Now, if you're at high altitude, you would think that would be bad because the air is thinner, the atmosphere is thinner. You have less oxygen. And because you're in a thinner atmosphere, you get more UV rays from sun and cosmic radiation and exposure to cold. Those are all things that you'd think would shorten your life. Lack of oxygen, more UV rays, all this. No, it's just the opposite. Live at high altitude, you live longer. Mind-boggling. You know, people live in higher altitudes, less oxygen, they live longer. More UV rays, they live longer. Exposure to cold, they live longer. And so there are things called heat shock proteins that when cells are damaged in some way, many proteins end up in the wrong shape, but heat shock proteins help them recover their form and function. So how are these shock proteins produced? Well, radiation exposure can do that. Low oxygen like go to a higher altitude where you'll be exposed to more UV and less oxygen. Ice baths. People jump into frozen lakes and things like that. That is good for the body. However, I don't like that. I try to I put a bath, bath and then dump ice in it. Man, I just don't tolerate that. I just don't like it. But I do saunas, and I do saunas 2 or 3 a week. And then when I do a sauna for about a half hour, maybe longer, don't overheat yourself there. I'll go and jump into a cold shower and generally get as cold as it will go. So that's as close as I'm doing to an ice bath. But there's a lot of studies that show saunas are beneficial. I like the idea of sweating and flushing toxins out of my body, that kind of thing. And then, like I said, I'll do the ice baths to try and help my immune system even more. Now, we talked about vaccines and how a few vaccines might be a benefit, but there's something out where there's some vaccines that I believe are just bad. And here's an article that March 28, 2026, and there's a new study came out that, and here's the title: myocarditis affects only COVID vaccinated use. Young children. Myocarditis affects only COVID vaccinated children. And they found that for this myocarditis in the 15-month period during the COVID pandemic, found that 0 healthy children died of the disease. Myocarditis and pericarditis, sometimes fatal inflammatory heart conditions, affect only vaccinated kids. This peer-reviewed study conducted by the University of Chadford. I gotta make this bigger on my computer. Okay, there it is. The peer-reviewed study conducted by research University of Oxford and the Harvard T.H. Chan School of Public Health, and published in January in the scientific journal Epidemiology, looked at the safety and effectiveness of the Pfizer COVID-19 vaccine in healthy children ages 5 to 15 following the rollout that began in 2021. And they noted, and I quote, that myocarditis and pericarditis were documented only in the vaccinated group. Only in a vaccinated group. Critics may say these rates are quite low. They would have a point too, where COVID like influenza, if the COVID shot were like the influenza shot. But note here, the Center for Disease Control's own data indicated that someone 0 to 19 years of age who contacted the coronavirus, listen to this, children 0 to 19 who contact the virus had a 99.997% chance of survival. What's more, we learned in 2021 that the average COVID death age was greater than the average lifespan. Average COVID death age was greater than the average lifespan, which means who is dying from COVID? The old and sick people. So, what can be said about giving even healthy kids briefly tested shots to treat a disease that doesn't actually imperil them? And they say it's grossly unethical. And they go through in this article, and you can Google it and find it. And they talk about several sad cases of young kids dying, getting very sick, or dying within days or within hours of getting the COVID vaccine. When children 0 to 19 years of age have a 99.997% odds of tolerating COVID, why even vaccinate them? Other countries did not vaccinate like we did. They didn't vaccinate, they didn't mandate the coverage. And so these kids now are the vaccine. Okay, here, down at the bottom, despite these findings and many others like them, a coalition of medical organizations are fighting to legally force the government to keep recommending that even healthy kids and pregnant women take the COVID jabs, in spite of science, in spite of the most intense study that verifies that these vaccines cause problems. Coalition of medical organizations are fighting to legally force the government. See, this is what blows my mind. They keep the vaccine. The people who want vaccine, they always spout science. Well, here's science, and you want to ignore it. You want to dismiss it. Why? Okay, I've got a friend of mine who is being a little bit prosecuted and persecuted because of her stance on vaccines. But the people she's having an argument with don't want to look at the science. Or I'd say, show me your science that validates the reason to do the vaccines. Show the quality studies, the long-term studies that validate what you perceive. I know people say, the polio vaccine. Go back and truly read the origin of the polio vaccine and what was happening. Polio was declining in countries that never got the vaccine. In fact, polio was going down long before the vaccine. Polio is a disease of filth, basically. It's a disease of filth. You get good sewer systems, clean water, and polio is going to go down. It is a disease of filth. And is it the vaccine today? No, it is thanks to refrigeration, sanitation, and clean water. That's where we're at. But if you still think polio was stopped and cured by the vaccine, you need to study more. And you're, I know somebody had polio. Well, you look what was going on in the environment. What were they doing? But there are certain toxins in our environment that will give polio symptoms. And you need to read that. I'm not going to take the time now to go into it. It's pretty fascinating. But why, if science is the gold standard, why are medical systems, medical organizations, pediatricians, why are they fighting this? Because there's money involved. I have no stake in whether you vaccinate or not. Whether you want to get your kids vaccinated, whether you want to get vaccinated, it's not going to affect me one way or the other. But the medical profession, that's their money. You're talking big money on vaccines. It's not going to affect my pocket one way or the other. I'm just trying to keep kids healthy. If people, in fact, not just children, 99.9% of the world population did not die during COVID. They didn't die from COVID. 99.9% of the population did not die from COVID. Now, you'd like to think that it was this horrible disease, but most people got it and they got over it. My mother in her 90s got it and she got over it. Without any vaccines, without any drugs, the only thing I had her recommend the hospital take was oxygen. That was the only thing that we allowed them to give my mom was oxygen at 90 years of age, and she breathes right through it. And so I know that's not the medical model because they're in it to sell drugs. I know they think they're doing the right thing, but why don't they even look at these other studies in science? Oh, it's time for a break here. Okay. Hope that helps. Hormesis, I'm Dr. Merkle. We'll be right back. And we're back. I'm Dr. Merkle every Saturday, 11 to noon, 937-433-3241. That's 433-3241. Our website is take2healthcare.com. Oh, by the way, next month, there is a thermography discount. May thermography, I don't know if that's breast cancer month, but there's a special thermography. I'd recommend that you sign up, get your place scheduled for that. There are limited spaces, and you can go online and get more details at take2healthcare.com. And hopefully this today has been informative. Sometimes a little bit of toxin is not bad. I'm not saying go out and do it, but I do believe that there are certain things that are toxic regardless. I think smoking is probably one of them that are toxic. And I think that you can be overwhelmed, and maybe this COVID vaccine is something that is totally foreign and modified in some way that our bodies just don't handle very well. Some people tolerate it, but some people don't. And to give a young child a lifetime of health problems with myocarditis and pericarditis for something that is basically not even an issue should not be done. this should not be done. The science is very clear that children should not be given the COVID vaccine. So I know it's time for me to go. Say, do something today to be healthier than you were yesterday. Take a walk, call a friend, pray for our country, and go to church tomorrow. I'm Dr. Merkle.